Okay, right. Good morning. Good morning, everyone. And welcome to, sorry, just 1 second, please. No, I meant if you could. Okay, all right. Okay, thank you. Right, good morning, everyone, and welcome to Target PLAB, the Target PLAB Academy for your PLAB2 preparation mostly. Of course, we will be starting the PLAB1 soon, but at the moment, it's the PLAB2 that we are specializing in. Today is a free webinar on UKMLA because UKMLA is just around the corner. You have got only a few months left in 2023 in this year, and then we are in 2024. And sometime in 2024, the next year, UKMLA is going to be launched. So we will be discussing as to how you should be preparing for that. And also, of course, we'll give you the introduction and the information about PLAB2, because that is what is currently the exam that you will be preparing for and you'll be taking. So, let's now begin our presentation on the UKMLA and PLAB2. And we are Target PLAB Academy. As you already know, we are here to help you in your journey to join the NHS, and we help you in every step of the way. So not only is the PLAB2, but also after that, we will we do a course on the interview and the CV as well. So once you've passed your exam and you have secured your GMC registration, of course, the next big step is going to be for you to apply for jobs and have a successful interview and secure your job. So for that, again, we offer a dedicated course. In fact, our students, those who have joined the PLAB2 full course with us, they get that course complimentary, so they do not actually pay anything extra for that, for the interview and the CV course. Right, so PLAB2 Academy, the Target PLAB Academy, we are based in London, in the east part of London. It's called Barking. We are very close to the station, so it's very easy for people to come into the academy. It's a very cosmopolitan area, so you know, whichever part of the world you are from, you will feel at home, because you'll find restaurants, foods, and also cheap accommodation in this area as well. Talking about the accommodation, if you need any help from us coming to London to join the academy, please just write to us, and we will put you in touch with people, and you will get a good accommodation very close to the academy to stay. A brief introduction of me. I am Dr. Malik, Dr. Shahzad Iqbal Malik. I have over 18 years experience of working in the NHS. Half of that period I worked in hospital, in various surgical and medical specialties, and I completed my MRCS. So I'm a member of the Royal College of Surgeons of England. And then I changed direction and I joined the GP training. So I did MRC GP. So I'm a member of the Royal College of General Practitioners. And for the last number of years, I've been working as a GP as well. But more and more, I am now involved in the teaching, and especially my focus is on helping the international medical graduates with their PLAB exams. And therefore, I am the founder of the the Target PLAB Academy. I believe in very high standards of the course because I fully understand how important, vital it is for you guys to pass the exam and pass it in the first attempt, ideally. So therefore, I do not compromise on standards. I do not delegate anyone to run the lectures or assessments for me. I do everything myself. So you get full hands-on supervised training from me in your lectures, in your workshops, in your assessments. Of course, I have help. I've got a very capable colleague who helps me in my courses, and we all make sure that you pass your exam. So why PLAB? PLAB, of course, as you know, is the way for you to get registered with the GMC, General Medical Council. For IMGs, International Medical Graduates, it is mandatory. It is a good time to actually come and join the NHS in the UK because the Brexit has happened. So a lot of the European doctors have actually left the NHS, and therefore there's a lot of space for new doctors to come and join. PLAB is the Professional and Linguistic Assessment Board exam. It comprises of 3 components. The first one, as you know very well, is the English component that you can achieve by doing either the OET or the IELTS. So you have done that. Then is your medical knowledge assessment with the PLAB1. You have done that as well. And this is your last exam now before you get registered with the GMC. That is your PLAB2. So PLAB2 is an OSCE examination. So OSCE is Objective Structured Clinical Examination. What does that mean? Objective, let's just split the whole OSCE into components. So objective, meaning it's not down to the, it's not that the examiner who is sitting in the cubicle when you go into the exam, if the examiner looks at you and he or she likes you, then they are going to give you a good score. And if they don't like you, they are going to fail you. No, it is totally objective. Yeah, so they have a written instructions with them on their iPad, exactly how to mark, exactly what to do in your assessments. So there's a question here, guys. You're free to write down your questions here. I will pick up some questions as I go along the lecture, and the remaining questions I will answer at the end of the lecture. So I will just take this question. He says, "Sir, PLAB replaced by UKMLA, or it will take time?" So yes, we are going to be talking about it in about 3 to 4 slides down the line. What is going to happen? How is UKMLA going to kind of, become a part of the PLAB? So we'll talk about that very shortly. Right. Okay. So the OSCE is the objective exam. So it has to be, it is objective. The examiner is instructed clearly how to mark you. It's not their liking or disliking of you. It is just based on your performance. It is structured, meaning it's not that you are sitting in a clinic with someone, some senior doctor, and then at the end of the clinic, you will be marked. Okay, right. The patients are coming randomly. The patients are coming in that senior doctor's clinic. Some of them you are seeing, and then he's just looking at you sitting, and then he says, "Okay, doctor, you have done very well in the clinic today, and you are a pass or you are a fail." No, it is structured, meaning it's clearly defined that there are going to be 16 stations, and everybody on that day is going to get the same 16 stations. All the stations, each one of them is going to last for 8 minutes. And it is going to be the same for all the candidates. So it is a very structured exam. So therefore, why is it important? It is important so that you know that if you are going to work hard and if you are going to perform the right manner, then you are certain to pass the exam, and you should be. So therefore, it is important for you to know that it's objective, it's structured. What you don't have to worry about the bias in the exam or any problems in the exam. It's already out. It is very, very monitored exam. Therefore, all you have to do is prepare in the right manner, in the right direction. And this is what we are going to help you to do. And our aim is to help you pass in the first attempt. Pass in the first attempt. Or even if it's your second attempt or third attempt, if it's your first attempt with us, we consider it as the first attempt. And we will ensure that you pass. Any one of you who will be attending our academy, if we feel that, okay, you know, Dr. A, Dr. B is good, they are fine, they're going well. No, but Dr. C and Dr. D, they need a little bit more input. We will tell you there in the academy, the guys, you need a bit more of input, a bit more of support and preparation. So we will arrange extra teachings for you. Extra teachings for you that will be just targeted for you so that you also can improve and become like Dr. A or Dr. B. We want every single one of you to pass in one attempt with us, and that's it. Of course, if it's a bad luck and you guys don't pass, then you are very welcome to just come back to us, practice. Our academy is like 24/7 open. You can come here in the middle of the night and start practicing on the mannequins. They're open here. And, you know, we have open access to the SimMan. You can just practice. You can start the SimMan with the sounds and everything, with all the monitors and everything. You practice hands-on. So, and you can attend our courses, the next course, you know, online course, face-to-face course, until you pass. You will have ongoing support from us. So, it's the OSCE exam. It's the Objective Structured Clinical Exam. It comprises of 16 stations, and there are 2 rest stations. There are 2 sessions in a day, a morning session and afternoon session. So you might be getting a morning or an afternoon session that you will find out when you book your exam. And the stations will be the same for that very day when you will be appearing. So you will be marked against the same candidates, against who are performing the same kind of cases, who are performing the cases with the same simulators, with the same actors. Yeah. So therefore, it will all be the same. So meaning, if that day is a tough day for you, the cases were tough, the simulators were a bit tough, then don't worry, because it was the same for everybody on that day. Meaning, the pass score of that day will be lower. So you do not actually have to work very hard to pass the exam, because the pass score will be lowered on that day. Or on the other hand, if on that day the cases were easy, the simulators were nicer and softer on you, then the score will be higher. You will be scoring high, everybody will be scoring high, and then you will pass. Okay, so talking about the UKMLA now. So the UKMLA is coming. Yeah, it is coming. It is coming in a few months' time now. And we are going to ensure that when it comes, and for those of you who are going to be taking the UKMLA style of exam instead of the usual PLAB2 style of exam, we will prepare you for that. You will be completely up to date. We have already started looking into it. As the information is gradually coming from the GMC, we are updating our information for you, and we are updating our courses for you, so that you stay absolutely ready for whatever style of exam you will be sitting in. If it's PLAB2, that is happening at the moment, then you should be ready. You will be ready for PLAB2. And if it's UKMLA, that is coming next year, then you'll be ready for that as well. So it's coming in 2024. And it will be at par. You will be at par with the UK graduates. So you will be the same level. The UK graduates, this is the whole idea of UKMLA. At the moment, what's happening is that the UK students, the UK medical students, when they complete their final year and they become a doctor, they only have their medical school, medical colleges assessments, exams, and they graduate and they go for the GMC registration. For the IMGs, international medical graduates like yourself, you guys have to pass the PLAB exam. They are going to make it the same but from next year. So there will be a medical licensing examination, MLA, or the UKMLA, and the same exam will be for the UK graduates as well as for the IMGs. So the standards will be the same. At the moment, so it is for who? It is for the UK graduates and for the IMGs. At the moment, what they're doing is that they are kind of, the guidance is stating that it is possible that the MLA might be an exam, the name might be MLA for the UK graduates, and the PLAB may be changed according to the MLA. It is not very clear if the exam for the IMGs may still be called the PLAB exam, but it will be basically the pattern will be changed to the MLA. Or they might also call it the MLA exam, so the UKMLA. We will find out very soon as the information is gradually coming from the GMC. So under the UKMLA, the exam components will be named differently. Instead of calling PLAB 1 and PLAB 2, they will be called, PLAB 1 will be called the AKT, that is the Applied Knowledge Test, and PLAB 2 will be called the CPSA. That's the Clinical and Professional Skills Assessment Test. So the name is very important, clinical. So they'll be checking your clinical skills. Yeah. How do you take history? How do you examine the patient? How do you make the management of the patient? Plus, they'll be checking your professional skills. So professional skills is kind of where they are talking about the behaviors. The word that the GMC is using, behaviors. They will be assessing the behaviors of you in the MLA exam. And the behaviors will be, it'll be kind of similar to what they're testing now at the moment under the name of IPS, the interpersonal skills. So how do you relate to the patient? How do you talk to the patient? Are you polite? Are you respectful? Are you ensuring their privacy? Are you providing them support? Are you showing to them that you are empathetic? You're showing the empathy. So we will be talking about that IPS soon. The scenarios that will come in the clinical exam, in the CPS exam, will be structured around 3 themes. One theme is to assess the readiness, if you're ready for safe practice. So what does that mean? That means that they will assess if you're ready for clinical practice out there. And when you're going out there for clinical practice, what kind of scenarios in real life will you be encountering? The scenarios in your real life will be either you'll be dealing with some emergencies. For example, there's a child who's got a rash and has got a fever, high fever, who's a bit drowsy. So what does the child have? The child has got meningitis. It's quite likely the child has got meningitis unless it's proven otherwise. If a parent is talking to you on the phone, how will you manage this emergency? You will get an ambulance out, won't you? I'm concerned about the child, Mrs. Smith. We need to get her seen in the hospital urgently, immediately. How can we do that? How far are you from the hospital? How quickly can you bring him or her to the hospital? Oh, I'm far. I don't have a transport. No problem. I'm immediately calling an ambulance for you. They will be there in a few minutes' time. Please get ready. And I will inform the ward, the accident emergency, or I will be waiting here in accident emergency if you are in A&E. And I will receive you and we will start the treatment immediately. What else could be a medical emergency? A chest pain. Mr. Smith is sitting there. You're like an FY2 in GP. And he says, I've got pain, doctor, I've got pain. Are you going to say, okay, so you do all your data gathering, you take your history, you do your examination, it's kind of quite clear that Mr. Smith is a smoker, he's got strong family history of heart problems, His father had a heart attack at 48 years of age, so early age for a heart attack. So all the risk factors are there. And then his story is consistent with a possible ACS. What are you going to do? Mr. Smith, I think you've got a heart attack. And I think I'll refer you to a cardiologist now. Of course not. You won't do that. Mrs. Smith, I've got a heart attack. I think you need to go to the hospital. Okay, doctor, that's fine. I go home and because I didn't tell my wife, and then I will ask her if she can drive me to the hospital. Are you going to agree with that? No. Mr. Smith, I am concerned about you. It is quite possible that you are having a heart attack, and we need to get you seen as emergency in the hospital. I strongly suggest that we get an ambulance for you right from here and take you straight to the hospital. If you like, I can call your wife and explain this to her. Is that okay? Yeah, that's okay, doctor, of course. Save my life. So how will you manage an emergency? How will you manage a SIMMAN case? Yeah, a SIMMAN case, an emergency case. So this is what they will be testing for you. They will be also testing for you, how would you manage your chronic conditions? Chronic conditions like diabetes, like high blood pressure, how would you manage them? What other cases will they be given? You will be given in the UKMLA? Managing uncertainty. So if there's an uncertainty over diagnosis, meaning, there's a bit of a various, like a person is coming, having a bit of tingling or numbness in the hands or in the feet. And then you take the history, and are you going to say to them, okay, you've got the Guillain-Barré syndrome, or you've got multiple sclerosis? Can you say this to them? You're GP, you are FY2 GP. No, you can't. You have not got the blood tests. You have not got the scan, an MRI scan of the brain. You can't say that. It is an uncertain diagnosis. Mrs. Smith or Mrs. Smith, it is difficult for me to say for certainty as to what condition you're having, but it looks like it's a condition that is related to your nerves. I've discussed with my seniors. We will arrange some blood tests for you. We might be referring you to a specialist called a neurologist, and they might be doing a scan of your brain as well. So you have to manage the uncertainty about the diagnosis or uncertainty about the prognosis. Doctor, am I going to get well? Ms. Smith, it's very difficult for us to know at this stage. The first thing is that we get more information about the condition. We need to discuss with the specialists, and then we will see, then we will be able to discuss with you how things will progress from here. So you have to be honest, and you have to deal with the uncertainty about the prognosis. Mind you, this is something that you must expect in your PLAB2 exam as well. It's not that these cases are going to come only in the UKMLA next year. Similar cases are coming now. Similar cases, because why? Because look, the PLAB2 exam is also a reflection of what is happening in everyday life in the NHS when you're working as a GP or you're working in the hospitals. So you're still encountering, of course, cases about possible multiple sclerosis, Guillain-Barré syndrome, or other spinal or brain-related issues. So therefore, your approach to management will still be the same in the PLAB2 exam as well. When would you call for help? They'll be assessing you for that. Delivering person-centered care. So meaning they will be assessing you. They will be giving you scenarios in the UKMLA to check, are you delivering a care that is doctor-centered or that is patient-centered? Are you saying, okay, patient, listen, I know you have got for example, I know you have got a chest infection, and I'm telling you, you take antibiotics. End of story. No, not like that. Mr. Smith, from what I've gathered, so you have to word it in a nice manner so that the patient doesn't feel inferior to you. You should talk at the same level as the patient. The patient should be at a friendly level with you. That is your rapport. This way you involve the patient in the management. You encourage them to open up to you, to talk to you about their issues, and to get involved in the management. Mrs. Smith, it sounds like you've got an infection of your chest. How does it sound to you? Mrs. Smith, there are two options here. One is that we watch and wait, because sometimes the infections get better themselves in a few days' time. The other option is that we can give you some antibiotics. But looking at the condition, it looks like you've got a fever, there are a lot of sounds on your chest. The best option is that you take the antibiotics. What do you feel about that? How do you feel about that? So involve them. So listen, involve the patients, take account of their comorbidities. Don't treat them in isolation. For example, okay, I'm going to give you clarithromycin, and now the patient has got a comorbidity of high cholesterol. And for the high cholesterol, the patient is on a statin. So you must keep that in mind. Ms. Smith, I know that you are taking statin for your high cholesterol. So for the days of this antibiotics, please omit. Please do not take your statin, because they interact with each other and it may result in severe muscle pains. So you would take account of their comorbidities. You would take account of their social situation. Mr. Smith, so Mr. Smith is like 80 years old. Mr. Smith, who do you live with? I'm living alone. Ms. Smith, the way you are, do you think you'll be okay to cope alone at home until you get better? Who does shopping and cooking for you? Do you think you need some help with that? No, doctor, I'm fine. Oh, yes, doctor, I need some help. No problem, Mr. Smith. I'll discuss with my seniors, and we will contact the social services and see if we could arrange some carers for you who will come to your place and they will help you with your shopping and cooking. Is that okay? Yes, doctor. So take account of their social situation. Collaborate with other team members. So you are seeing Mr. Smith in A&E. Now, Mr. Smith is going to go home. He lives alone. He's going to start taking antibiotics. He's got a bad chest infection. Are you going to leave him alone? No, you will not. Of course, I know you will not. Are you going to arrange a follow-up for him in A&E? That is not possible. You do not have a follow-up clinic in A&E. So you would collaborate with your other members. They might be in your hospital, other team members, or they might be in some other place, in some other setting, like a GP. Mrs. Smith, I will write to your GP, inform them about your attendance here today and what we did today, meaning the antibiotics, and I will request for them to see you and as a follow-up. So you will arrange a follow-up and involve your team members. So this is all that you'll be doing in the UKMLA. Now, UKMLA content map. This is from the GMC's website. So this is the content map, meaning that these kind of questions will be coming in your UKMLA. There will be some kinds of questions that will be coming from the areas of your clinical practice. So things like, they'll be coming from surgery, from medicine, from care of the elderly medicine, gynecology, psychiatry, all of that. There will be some patient presentations that will be coming. So like, patient is presenting with a lump, the patient is coming with some rash, the memory loss, multiple trauma, etc. The patient will be coming with various conditions like asthma, migraine headaches, anorexia, eating disorders, cancers, so those kind of things. Sorry. There'll be some clinical some scenarios will be checking your clinical and professional capabilities. For example, are you able to assess the risk in certain cases? For example, are you able to safeguard the vulnerable patients? Who are the vulnerable patients? Who are the two groups of vulnerable patients, guys? Write in your chat, please. Yeah, please write in your chat who are the two groups of vulnerable patients, because these cases are coming in the PLAB2 as well. Yes, that's right. So the two groups of vulnerable patients are the children and the vulnerable adults, the older patients. So for example, there could be, that a patient is coming in, a lady is coming in and she's feeling a bit low in her mood, or she's got headaches. And when you find out she's got domestic violence, then it's important for you to check who else is at home. Could there be any children at home? And then you have to ask if the children are safe. Likewise, you have to do the same for the older patients. The other cases will be coming in the UKMLA will be on the practical skills and procedures. Just like in PLAB2, they will be keeping the practical skills and procedures. So it means that the mannequins are going to stay. Yeah, because there was a talk if the mannequins are going to be omitted from the UKMLA, but it sounds like no, they are not going to be omitted. They are going to stay in the UKMLA. And then the other type of cases will be the areas of professional knowledge. So things like, the medical ethics and law. For example, your Gillick competence. A young girl is coming to ask for contraception. She is 14 years of age. Are you going to give her the oral contraceptive pill or not? So the Gillick competence, the law applies here. Yes. Likewise, there are other laws as well, isn't it? Like, for example, the data protection law. That is about the confidentiality. The mother is coming asking you, did you give my daughter the tablets, the oral contraceptive pills? The law is the data protection law that protects the confidentiality of this young patient, and therefore you cannot disclose the information to the mother. So laws like that. Likewise, the DNA CPR, the advanced decision, those kind of laws coming as will also be assessed in various cases, and they continue to actually happen in the PLAB2 as well. So let's come back. So that was our that is the information that we have at the moment about UKMLA, guys. Yeah, keep watching our webinars. We are running it free for you guys about the UKMLA on a regular basis. Keep watching them. As more information is released by the GMC, we will keep informing you so that you're all prepared for the UKMLA. And of course, if you come and join our academy, you will have training from us and coaching from us to prepare you for the UKMLA style. Let's come back to the PLAB2, like the structure of PLAB2 and the introduction of the PLAB2 and how you're going to prepare your PLAB2. You all know that the PLAB2 is each station in PLAB2 comprises of 9.5 minutes, 1.5 minutes, 90 seconds you spend outside of the cubicle reading the task, understanding the task, and then you go into the cubicle where you have 8 minutes. There will be a bell at 6 minutes when you're inside the cubicle to inform you that you have got 2 minutes remaining to complete your task. So when you on the on your exam, take 2 documents with you for sure. One is your ID, a photo ID, yeah, and that is can be your passport or a UK driving license, and your GMC confirmation letter. So this is a courtesy of the GMC website, and these are various pictures. So this is the Hardman Street in Manchester, where and of course there is another center, the Hardman Square. So you could be in either of the 2 places on your exam day. You arrive at the center, you go to the reception, inform them that you're there, your IDs will be checked, you'll be given a badge that you will stick on your chest. You will put away your belongings in a locker and the key. Keep the key with you. You will be then taken to a waiting area. There you'll be given a brief talk about the day. This is how the circuit will be looking like. So you will have rooms, various rooms, various cubicles. And as you can see, outside each cubicle on the wall will be the task that will be pasted. You're reading the task will be giving you who you are. You are going to be an FY2 always, where you are. So it is important to remember where you are, because you could be in a GP setting or in a hospital setting. And that is very important to remember, because in the GP, remember, you cannot do blood tests on the day. If you need the blood tests, you cannot do them. You cannot do an ECG on the day. You cannot do an X-ray or scan in the GP setting. And you cannot, of course, admit the patient. You can do all of that if you are in hospital. The other information will be who is the patient and what is their history, if there is any extra information about that, and finally, what you are required to do. If you're going to be taking history and doing an assessment, making a management plan, they will do that. If they want you to spend most of your time doing an examination or doing a procedure, they will make it clear in the task. That take a focused or brief history and do the examination. Yeah, just for example, examine the cranial nerves, because they know that cranial nerves is going to take like 6-7 minutes. So they will just make it clear for you. And if there's any special note, that will be there as well. So you read it, you think about it, you make a plan how you're going to do it. And of course, for our students, we give them tasks. Because we do a lot of role playing every single day. It's like a session of role playing. It's not only the lectures, it's role playing, and then we give them tasks, and then they just prepare in their mind how they are going to structure their performance, and then they start off and they perform within 8 minutes. Okay, so you enter the cubicle and you shout out your name and your GMC number, and then you would be approaching the patient. The patient might be sitting in a chair. The patient might be sitting or lying in a cubicle. The other thing is that your task that is pasted outside, that will also be a copy of the same will be on a table. So if you kind of forget anything about the task, then just ask the patient, ask the examiner, may I please, before asking the examiner, remember IPS. So remember, it's not that when you are in the cubicle, you give no importance to the patient. Listen, patient is your most important person in the cubicle. After the patient is your examiner. So if you are needing to go to look at the task, don't just ignore the patient, turn around and say, examiner, may I look at the task? And the poor patient is just wanting to talk to you about something, and they said, okay, right, the doctor is gone. So it shouldn't be like that, because you will be marked, against the IPS. So you would say, excuse me, Mrs. Smith. So just say something, Miss Smith, excuse me for a moment, please. So first, the patient, then, excuse me, examiner, may I please look at the task again? Yes, then you go. And really, that will go a big way in your IPS. It will be noted down by the examiner. Okay, the patient was kind and took patient's permission to go and look at the task. So give a lot of importance to your patient. And the other thing that you have to be kind of careful about is what else is in the cubicle. If there's an instrument in the cubicle, if there's a mannequin in the cubicle, because then that would mean that in this station you have to do a procedure, or in this station you have to do an examination. So that is important, because then you would take a focused, brief history from the patient and move on to the procedure. Because most of your marks in this station are for your procedure or for your examination. So it's important to kind of keep good eye and just look around. Sometimes the cubicle can be quite big. And you just, of course, it's a lot of stress when you are in the exam. So you'll be just kind of just looking like this and just look at the examiner quickly look at the patient, go quickly to start talking to the patient. You have not even looked around. You have kind of just missed that there was, for example, some mannequin of a antenatal examination, or a mannequin of a breast, or a mannequin of a tummy lying there. So keep an eye, keep your eyes open, look around, and then move on with your task. The examiners will be there sitting very quietly. They have got nothing to do. They are not there to talk to you. Yeah. So they're all sitting there only quietly, watching you and marking you. Only in some cases, it's possible that the examiner might just want to kind of ask you some questions. For example, in a SimMan case, when you're performing something and then you've done something, and then the examiner might ask you some questions. Yeah. Otherwise, they are there just to kind of quietly sit down and mark you. There might be some other person there who's an observer, who's going to be your an examiner in the future, or they might be there just to kind of ensure the standards of the exam. There'll be a camera there because they record everything, so that they can kind of review it later on if required. More and more now, the telephone and the video stations are coming. And why is that? Because, as said previously, the exam is a reflection of everyday practice in the NHS. And things have changed since 2020, the COVID times. A lot of the consultations are now happening on the telephone or on the video. And only after we have done the telephone or the video consultations, we feel that, okay, this patient needs to be seen face-to-face, then we arrange a face-to-face appointment for them. Or we arrange for them to be seen by some other colleague of us. For example, in the hospital, say if you're working as a GP, and then we then send them to the hospital. So a lot of the consultations are in practice telephone or the video. Therefore, there are a number of video and telephone consultations here, but the pattern and everything kind of stays the same. In a telephone station and a video station, you will have either the telephone or a video screen in front of you. When you go in, you do not need to press any button. It will be just kind of live for you the moment you go in and you start your case. And you'll be doing the same. The important thing is, in the telephone or the video. So as said, in practice, what are we doing? What we are doing is that, for example, there are 10 slots. So, for example, there are 10 slots of telephone patients. So there are 10 telephone patients on the list. So there's a clinic, yeah, and there are 10 telephone consultation slots. For 10 consultation slots, you have 2 or 3 face-to-face only. Meaning you speak with 10 patients and you're triaging the patient. Triage means that you decide who is safe and who is okay to be treated just on the phone, and give them the advice, give them the medicine. They will look after themselves, they'll be fine. And those who are not safe, who are serious, so they need to be seen face-to-face. So what you do, you say, patient 1, okay, oh yeah, that's the advice. Go home, stay at home, this is the medicine. Okay, this is the advice, no problem, it's a viral infection, it will go itself. Stay at home. Okay, no, you have things, it's possible you've got meningitis. You need to be seen. You get them to the A&E. Okay, now, hello, yes, okay, I've got pain in my knee and this and this and this. Okay, no, you are going to be coming here and I need to examine your knee. So that patient you'll book into your face-to-face slot yourself. So what it means is that in your telephone and your video consultations, the most important thing is that you are taking the history and you are ruling out the red flags. So you rule out all the red flags. If someone has got fever, you automatically are going to ask about the rashes, about the neck stiffness, about the drowsiness, Are they passing urine or not? Are they eating and drinking or not? What are they doing at the moment? Where are they? So you will ask all the red flag questions. Have you done the glass test on the rash? Is the rash blanching, fading on pressure or not? You'll be asking all those questions. If someone has got a rash, then it's a video consultation. Can you bring the child in front of me? Can I please look at the child? I want to look at the child. If the child is looking active, is the child looking a bit drowsy and tired? How's the rash looking? So you would be, if someone has got cough, what are they doing at the moment? Are they able to talk? Are they talking in full sentences or in broken sentences? So you want to rule out the kind of the red flags. It's a triaging. And if there are any red flags present, okay, I need to see you. Please bring them here, or I am going to arrange an ambulance and you go to the hospital. So that is your telephone and the videos. In the rest stations are for rest. Don't do anything other than resting. If you need to go to the toilet, go to the toilet. Drink some water, a little bit, not a lot. Don't fill up your bladder, because then again, you in the middle of the circuit, you'll need to go to the toilet. So just relax. Don't think about your previous stations. What's happened has happened. Just calm down your mind and prepare for the next stations. And then finally, you'll be, and the other thing is that where would you start? So here, just wanted to kind of miss you, that look, you will be told. So look, there'll be 18 of you. In a circuit, there'll be 18. Yeah, so it's 16 plus 2, 18 people. So you'll be told where you're starting. You might be starting at cubicle 1, or you might be starting at cubicle 10 or 12 or 18. Someone might be starting at the rest station. So you will be told either verbally, or it might be stated on some sticker, on some badge that you'll be given. And you'll be starting over there, and then you'll be doing a circuit. At the end of your exam, you'll be then asked to take your belongings out of the lockers and leave the station, leave the exam center. A new PLAB2 exam. The new PLAB2 exam, your focus, meaning since 2016, what they've realized is that there are two important things that they want to test the IMGs for, because they felt that the IMGs, the international medical graduates, lack on them. One is the communication skills, and the other is the ethics. So a lot of communication skills and the ethics is kind of marked together as your IPS as well. So therefore, IPS has got much higher importance since the 2016 the new PLAB exam. Let's look at various kind of example conditions, like because this is the kind of conditions that you'll be. This is kind of scenarios that you'll be having in your exam. So, for example, someone is coming, and you must be considering their social and economic situation. Just like I gave you the other example of a Mr. Smith having bad chest infection. You're giving him antibiotics, sending him home, but do check with them their social situation, because Mr. Smith is 80 years old. Will he be okay at home? If he's not going to be okay, then you have to arrange social services, or you can speak with your seniors and see if you would want to keep them in until they're a bit better, and then they can go home. Child protection, just like I gave you the example. Some mother is coming, and mother has got domestic violence. The husband is beating her up. You're not going to only treat this mother just because she's your patient. No, you have to think a bit bigger than that, a bit wider. Who else is at home? Could there be any children at home? How old are they? How's the bonding between the father and the children? Do you think that they could be at risk as well? If she says yes, they could be. Mrs. Smith, I'm really concerned about the safety of your children. I'm going to discuss with my seniors, and we are going to involve the social services. And that is for the best interest of your children, to ensure their safety. Adult protection. A lady is bringing her mother. The lady is already burdened. She's working. She's got 2-3 children to look after. The mother lives with her. And this mother is like 85 years old. And now, then you have to be a bit careful. So the mother has fallen. Is it the first time that she's fallen? Has she been falling before? Is this the only injury that she has? Or she has other injuries as well? How old are those injuries? How is the mother looking? Is the mother looking frail or she's looking healthy? How are the clothes looking? She's well dressed or she's looking a bit neglected? So then if there is a situation, then wait. I'm concerned about your mother. And I'm going to discuss with my seniors and we will involve social services. Social services are there to help and support you and your mother and you. To support you, because I can clearly see that you are burdened with a lot of other things. You have to do a job, you're looking after the children. They will help and support you. And of course, they will help and support your mother and ensure her safety. So you have to involve the social services and adult protection. You have to be honest in your statements. Do not make things up. You have to be polite. You have to stand by the legal points. If someone is asking for a sick note and it's not required, then you have to say, I'm sorry, I cannot give you a sick note. But at the same time, offer them information about the Citizen Advice Bureau. You should be able to confront the colleagues. For example, if the colleague is drinking or taking drugs. Why? Because patients are your first priority. You have to be patient with patients or relatives who need a bit of patience, like the old patients, learning difficulties, complaining, angry patients. You have to be a bit patient with them. Be a bit polite. Repeat things for them. Offer them. Would you like me to talk to your parents? Would you like me to talk to your carers and explain the same to them? Praise the patient or the relative where appropriate. Show empathy when needed. And involve the seniors because you're referred to. And identify and acknowledge the pain. Smith, I can see that you're in pain. Would you like me to get you some painkillers? But don't do it in every situation, but in certain situations where it's required. And you should know the broad management plans. For example, is this patient going home? Is this patient going to be admitted? Is this patient going to be referred as a routine referral? And is this patient going to be referred as 2-week wait? Yeah, so 2-week wait guidelines, you must know. And if there's any chest pain, the patient is breathless, give them the oxygen, so do the emergency management straight away, like especially in these cement stations. Practical skills, you must know the practical skills, very important, and the examinations. Look, guys, for the PLAB2, be a bit methodical in your mind. Be a bit methodical. Remember, you have to pass 10 stations. One of them is prescription. Prepare prescriptions. It is mathematical marks. You write the correct prescription, you pass it. Therefore, we spend a full session on the prescriptions. Make sure that you pass your prescriptions. It is easy. Make sure you pass it. One station is for your SIMMEN. It's all about A, B, C, D, E. Keep doing your A, B, C, D, E. Keep listening to the patient. Anything that you identify is wrong, correct it as you are going along. Make sure that you pass it. Again, it's an easy station to pass if you know how to do it. And there are not many emergency situations, SIMMEN emergency situations. There are only a few. Practice them, and that's why we spend a full day on the SIMMEN in our course to practice every single one of you on the SIMMEN. First, you are shown by me how to do it. And then you do it in front of me, supervise, and then you keep practicing. Ensure you pass the SIMMEN. There is one to 2 stations on procedures, the mannequins procedures, and on the examinations. So, again, we have all the mannequins and we teach you all the procedures. First, you see how I do it, then you do it. All the examinations, first I show you how I do it, then you do it. We spent like 2 days, 2 full days on this. So this is your 5 stations. 5 stations, ensure you pass them. Then what you're left with, just another 5 stations to pass. And for those 5 stations, what you do is you just think of these possible scenarios. You read about them. I've got some videos on them as well, and I also run this high yield 3 to 4 days course where I cover all the high yield clinical scenarios. If you like, you attend that. You can attend it online from wherever you are. You just keep watching, keep reading, keep practicing. It's only 5 more stations to pass. Then you pass your exam. That's it. Your exam is done. So have a method to your preparation. Just don't keep working hard blindly, because you are just putting in a lot of effort without any goal, without any direction, without any strategy. Okay, let's look at the mark sheet and the feedback. There are 2 types of mark sheets, quantitative and qualitative. You all know that. Quantitative is what tells you your scores. What is your aggregate scores, and what is the kind of breakdown of the score per station. And in this mark sheet, the criteria, as I was talking about, that you have to pass 10 stations out of 16, plus you have to score above the average score of the day. Yeah, so generally your target should be 60% in each station. And this is your quantitative mark sheet. You're assessed in 3 domains: data gathering, clinical skills, and interpersonal skills. And each one of them carries 4 marks. So in total, each station is worth 12 marks. So data gathering, what does that include? That includes your history taking. So anything that you do to gather your data. You gather your data by taking history, doing examination, any investigations, any procedures. So that is all included in your data gathering. The next one is your clinical management. Yeah, what is included in the management? That is your diagnosis and explaining the diagnosis. If you can't reach a diagnosis, your differential diagnosis. And then your management and explaining the management to the patient and involving the patient in the management. Plus your follow-up and safety netting. Safety netting is telling them the red flags when they go home, so that if any of those happen, then they have to call you or they have to come back. And the third domain is your interpersonal skills. So interpersonal skills is your being polite, introducing yourself in a nice manner, building that rapport, that bonding with the patient, your right body language, your right facial expressions, picking up the clues, both verbal and non-verbal. So all of those things are your interpersonal skills. Interpersonal skills are the most important. They can make you pass a station, and if you don't do them, they can make you fail the station. If your interpersonal skills are nice and just scoring remember, it carries 4 marks. If you're all nice, you're connecting with the patient, you are talking to the patient, picking up their clues, responding to the clues, asking them what their ideas are, what their concerns are about things, what are they hoping from the consultation, you are scoring already 3 to 4 marks in that station done. All you have to do to pass the station is to score maybe 1 in data gathering, 1 in management. You're already 6. You're passed. So even if you didn't know what this station is about, even if you didn't know a lot about the management, just by keeping your interpersonal skills right, you're past the station. So that is the power of IPS. So work on them, and that is why I'm very particular on the interpersonal skills. When we are doing the role playing, when we are doing these practice sessions, I just pick up and I tell my candidates, my students, listen, this is what you could have said a bit better. Talk like this, say like this, because this is easy marks. The other feedback is your qualitative feedback. Your qualitative feedback is something like this. So here you're marked in 10 skills areas. So these are the 10 skills areas. It could be a tick, it could be a cross, it could be a Y, but whatever sign it is in these boxes here, you want to avoid them. Because if you're marked here, these signs mean that you did not perform very well here. So let's look at these skills areas separately. Consultation, when are you marked in consultation? If you're going a bit disjointed. In the history taking, the patient is telling you, okay, doctor, I've got cough. And then you say, okay, yeah, Mr. Smith, I think you've got a chest infection. What else do you have? Well, doctor, I also have headache. Okay, Mr. Smith, then I think I will get you, get a scan for you. So what are you doing here? Your consultation is not organized. An organized consultation is that the first half of the consultation is about data gathering. So here you should not be saying, okay, Mr. Smith, you got cough, so you got your chest infection. That is in your second part of the consultation, your management, where you talk about the diagnosis and the treatment. So keep gathering all the data in the first half, and then you move on to the management. Keep it structured. Diagnosis, when are you marking diagnosis? If you do not make a diagnosis correctly, or you are not telling them the differential diagnosis, because if you can't reach a diagnosis, that's absolutely fine, because that is one of those things that we discussed previously. It's an uncertain diagnosis situation, and that is absolutely correct to say it is difficult, Ms. Smith, to say for certainty what you have. The possibilities, however, are this. Just say the differential diagnosis. The other part of the diagnosis is explaining the diagnosis in simple layman terms to the patient. If you don't do that, again, you'll be marked in diagnosis. Examination. Either you don't examine when it was an examination session because you missed, you entered the cubicle, you didn't even pay attention. There was a mannequin lying there that you needed to examine. You didn't do it. Yeah. So then you marked an examination, or you marked it. Your examination technique was not right. Therefore, we spent a full day here to do the examinations. Or, for example, the findings were in the right breast, in the right side, and you examined it the wrong side. Then again, you mark in examinations. So keep an eye, in the room. There might be some equipment over there. For example, there could be a box containing the otoscope or an ophthalmoscope. There could be, like a trolley or something with the needles and other instruments to take some blood. Findings. When are you marked in findings? You marked in findings if you miss the findings in the history. If you miss the findings in the examination. If you miss the findings in the investigations. When, for example, you say, okay, Mr. Smith has got chest pain. Mr. Smith, I'm going to do some blood tests on you. Okay, doctor, the blood tests are fine. Mr. Smith, I'm going to check your vitals. Doctor, the vitals are normal. And then you forget to say, Mr. Smith, I'm going to do a tracing of your heart. Because you did not say it, you are not handed the ECG. And the findings were in the ECG. The ECG had the ST elevation. It was an MI. So you missed it. So you'll be marked in the findings. And you'll be marked the findings if you are unable to explain the findings to the patient. For example, you're given some blood tests to explain to the patient. For example, you're given an X-ray of the chest to explain to the patient. And you don't explain that to the patient in simple layman terms. Issues. When are you marking the issues? If you may miss the real issue in the exam. For example, just like I give you the other example, that a lady is complaining of headaches. But the real issue is domestic violence. You didn't get to the issue because you didn't build that rapport to the patient. And why you didn't build the rapport? Because you missed the non-verbal clues. The patient is looking down. The patient is looking sad. Mrs. Smith, I can see you look upset. I can assure you I'm here to help and support. And I can assure you that our consultation is confidential. Please tell me what is on your mind. Oh, doctor, my husband has been physical with me. He has been beating me up. And then you reach the issue. Yeah. Again, you remark in the issues, like, for example, if you do not realize in a sim man, you keep taking a long history. Okay, Mr. Sim man, do you smoke? Do you, Mr. Sim man, do you do regular exercise? Mr. Sim man, tell me your diet. Do you have a healthy diet? And poor Mr. Smith, Mr. Sim man is lying there saying, I can't breathe, I can't breathe, I can't breathe. And you keep taking your history, ticking all the boxes in your history. Of course, you remark in the issue. The issue is the patient cannot breathe. Mr. Simman, I can see you are struggling to breathe. I'm going to give you oxygen, 15 liters, via non-rebreathe mask. Put the mask on. I'm going to elevate the head end of your bed. Language. When are you marking language? If you're not talking very clear, if you're not very polite, if you're using medical jargon. Yeah. So yes, thyroid is a gland in the neck, and it secretes a hormone that controls our metabolism. Doctor, what are you talking about? Have you heard of there's a gland in the neck called thyroid? Have you heard of it? No, doctor. It is a small gland that sits in the neck, and its purpose is to secrete, to make a chemical called thyroxine, and thyroxine regulates the rate of our body functioning. So talk in medical, in layman's simple terms, not in the medical terms. Otherwise, you'll be marked here. Listening, when are you marking listening? Just as I gave you the examples, listening is both verbal and non-verbal kind of clues. So if you look, the patient is looking upset, sad, angry, acknowledge that. I can see you look this. I'm here to help and support. Yeah, or the patient is just saying something, they're telling you some important information, and you just jump on to the next question. Okay, tell me about this. You remarked in listening, you would have missed vital information that the patient has given you. So listen actively. Management. You remark in management, if you do not make a management plan correctly, or you do not involve the patient and explain the management plan in simple terms to the patient. Plus, if you are not doing a follow-up and safety netting, meaning don't tell them if you're not telling them the red flags. Rapport, we have talked about it. If you're not building that bonding with the patient, you should be a mirror of the patient. If the patient is looking sad, you should also look sad. Show your empathy. If the patient is smiling, you smile. Have the right body language. Show them that you're here to help and support. I cannot even imagine how hard it must be for you. I can assure you I'm here to help and support. We'll do everything we can to help and support you in this difficult time, Mr. Smith or Mrs. Smith. And finally, time. When are you marked in time? If you're not done your practice. If you've not done enough role plays. You kept reading cases and talking about it, but you've not done enough practice. Then you'll be marked in time, because you won't be able to complete your case within 8 minutes. Practice is the key. Therefore, in our full 15 days course, every day is a practice day. You get the lectures, then there's a session of practice, role plays, within 8 minutes. On first day, second day, our students struggle a bit. Come third day, fourth day, things start flowing. They get the hang of it. And then by the end of 18 days, they're all ready. Then they just do their mocks, further polish it on the day of the exam. They've already done it like hundreds of times. So there's no problem. And when you mark in one skills area, you can be marked in a number of other skills areas. Yeah. For example, if you're marked in management, you might also be marked in management and rapport as well. If you're marked in management because you did not explain to the patient in a simple manner, they will also mark you in the language. If you did not explain the diagnosis, you did not reach the diagnosis correctly, you'll be marked in diagnosis and you'll be marked in your management and in your language as well. So things kind of, one thing that you're doing wrong can result in crosses or ticks in a number of other skills areas. So these are your skills areas again. Some tips finally. So if the patient says to you, doctor, go and look at your task again, please, in the middle of the station, then just remember, they are trying to help you. So say to the patient, excuse me, patient, for a minute, please. Thank you, examiner, go and look at the task. And remember what you were doing, because whatever you were doing and you're picked on that, it means that you were doing something wrong. For example, you might be saying, okay, Mr. Smith, I'm going to admit you, but actually you are an FY2 in GP, you cannot admit. So you kind of forgot that you are in a GP setting. That's why the examiner picked you up. Or, if you finish the task in like 3 minutes, 4 minutes, and you're sitting there, you're missing something. They have run the tasks multiple times before they introduce them in the exams. And the tasks are timed, are given, and are structured in a way that they will take 8 minutes. No task will be finishing before 8 minutes. If you are finishing a task before 8 minutes, especially very early before 8 minutes, like 4 minutes, 5 minutes, you're missing something. So again, look at the task, because possible you might be required to do a form, like a DNA CPR form, or like I said, confirmation of a death form. So then refer to your, just remember what you're missing, read the task again. And if you're at any point, if you're lost, if you feel that I'm lost, and at some point you feel that, okay, I'm all confused, I don't know what is the issue here, what is the story here, I don't know, then a very good trick to, a very good tip here is to summarize. Mr. Smith, from what I've gathered so far is this. Is there anything I'm missing here? And hopefully the examiner will then give you a clue, and you follow that clue and you will go in the right direction. Okay, so that brings us to the end of our free webinar. And I hope that you guys liked it. As I said, keep in touch with us and stay in touch with us. If you have any questions, you can ask them now. So there's a question that when is UKMLA coming? Yes, the UKMLA is coming next year, doctor. And so you've got a few months left. But at the still, the GMC are releasing information gradually about the UKMLA. So in our future webinars, we will keep updating you about any further information that is released by the GMC. So great. I hope that you all enjoyed today's webinar, and stay in touch. And I look forward to seeing you in the next webinars. Take care and enjoy the rest of your day.